Okay, it's Dr. James Granger with Acupuncture and Injury in Marietta, Georgia. Uh, as promised, we're going to talk about vitamin B12, particularly the vitamin B12 injections. In my previous video, I had talked about using vegetables for weight loss. And then, of course, the question comes up, well, what about vitamin B12? Um, Vitamin B12 deficiency is noted in people who are vegetarians or vegan because it comes primarily from animal products. So supplementation is often needed for people who have those dietary constraints. Um, but what I'm going to talk about is the use of vitamin B12 supplements for just generalized fatigue and for weight loss. The vitamin B12 injections are intended for people who have specific malabsorption syndromes where their body can't absorb vitamin B12. Uh, it's kind of overused to use it just for generalized fatigue without doing any type of dietary changes or investigation as to what's causing the fatigue, lack of energy, weight gain. Um, for example, people will often go to their doctor and get a vitamin B12 just because they've complained about fatigue, but there's no investigation of thyroid or testosterone or other hormone issues. There's no change in diet first. And I have some issues with that because you've got to understand there's a couple different types of vitamin B12. You've got the methylcobalamin, which is more bioavailable. That's what comes in the vitamin B12 in the natural form. The cyanocobalamin is cheaper. That's what's in the injections. And as the name kind of implies, if you look at it closely, when it's metabolized, you get a small amount of cyanide in your system. The question then becomes, why would you get an injection of vitamin B12 where you have a cyanide risk, not to mention it's often packaged with aluminum or some other type of preservative or chemical in there with the injection? And if that's going to be your long-term solution, eventually you're going to run into a problem with that. The methylcobalamin, you can find that as a supplement. It's a little bit more expensive. That's why the cyanocobalamin is used by physicians and a lot of nutritional supplement makers uh, because it's cheaper. Uh, Another thing to note about vitamin B12 is it's water-soluble vitamin. So you can take as much as you want, but your body is only going to use what it's going to use. The rest is going to go out in your urine. That's why you'll see supplements for 1,000 micrograms, 5,000 micrograms of vitamin B12. Well, your body only needs 2 to 3 micrograms a day. Uh, 2 cups of yogurt, uh, 2 cups of milk uh, can give you your vitamin B12 for the day. Some other foods that are a good source of vitamin B12, of course, are eggs, chicken, seafoods like haddock, uh, salmon, mussels, oysters, crab, trout. Um, so the big question becomes, why is your doctor giving you an injection of vitamin B12 in the less bioavailable form when all he has to do is teach you how to change your diet? The word doctor means teacher. Well, it doesn't take too long to figure it out. They're getting you for 30, 40 bucks a week, sometimes more, to get a vitamin B12 for just the general complaint of fatigue, which could have a whole host of causes other than vitamin B12. Thyroid could be abnormal. There could be something else in your diet, something else lacking in your diet. There's really got to be some investigation before you just indiscriminately get a vitamin B12 shot. Uh, so what I would recommend people do is, one, if you're looking for a quick weight loss, like I said in the previous video, nothing but vegetables. Get a methylcobalamin based vitamin B12 supplement. If you're that concerned about being vitamin B12 deficient in a week or two. Um, if you have been diagnosed with vitamin B12 deficiency or malabsorption deficiency through testing, then certainly talk to your doctor about using methylcobalamin versus cyanocobalamin. I'm not saying there isn't a place for vitamin B12 injections, but what I am saying, it's often misused and overused just for the general complaint of fatigue or desired weight loss. Again, the dietary changes has to be at the forefront of the changes you make. You've got to have exercise to burn off the calories you got to take that you're taking in. You have to have the proper diet. Cookies and ice cream, you can do all the dieting in your world. It's not going to work for you. Vegetables, water, a B12 supplement, then start adding some fruits in. Do that for 2 or 3 weeks. You're going to notice changes in your energy levels, and then that creates what I call a positive cycle, where you're able to have more energy, exercise more, burn off more calories, and you get out of that rut where you're just fatigued and you can't even exercise. But in my opinion, just kind of indiscriminate use of vitamin B12 shots without a proper diagnosis, unfortunately, it's in common practice. My recommendations is the methylcobalamin rather than the cyanocobalamin injections. And even that is secondary to having a proper diet in the first place. You can follow us on YouTube, Facebook, Instagram, and Twitter, and we have more videos coming up in the future.